Hello there! Oh my god, I got headache today. I can't imagine I can work because that's our topic for today. Headache. Of course, everybody experience headache. So actually, headache is symptoms. It's a manifestation of underlying disease or your stress or underlying disorder. It's also known as your cephalalgia, headache, algia, or headache, okay, aching. These are referred pain to the structure of the head from deep structures. So for instance, you have abdominal pain because you're hungry, then you could have headache. If you're thinking too much or a lot, and therefore it will be referred pain to your brain. So those are example of that. Now, what are the causes? It's easy again. Just follow these steps and then you would have headache, okay? Or think of your enemy and then you will have headache as well. Or look at your face at the mirror and you will get headache. Just kidding. Okay, next. Okay, now any injury to the brain or trauma, if someone hit you or your head fell, you fell and then you hit the ground, you will have, or someone hit you on the head, that's cause headache as well. Cutting or decreasing blood supply to the brain because the brain needs oxygen and glucose. So if decreasing blood supply, therefore decrease glucose and the oxygen, you would have headache as well. That's why when you are hungry, you will feel as well as headache. Stretching of the dura mater, any form of increasing tissues or stretching to the brain tissues will lead to headache as well. Infections such as your meningitis, so encephalitis, so those could also cause a severe headache. And sometimes no organic cause. This is the most common type. It's a primary headache. So for instance, you have hypertension or you have stress, so commonly at work. So those are example of that. Okay, next. Pain is perceived because it released by the following substances such as your histamine, bradykinin, prostaglandin, substance P, proteolytic enzymes. These are substances or neurotransmitter that excites nerve endings. So therefore, keeps going and going and until you feel the pain. Now, these substances are relieved if we take some medications or you feel relaxed because these endorphin and enkephalins are opiates derivatives that relaxes and slow down the stimulation of the nerves. Okay, so that's why when you do yoga, when you do your relaxation and you feel relaxed, these substances are released on the nerve endings and you feel relaxed. Okay, now there are types of the intracranial headache. Let us know. Headache, meningitis due to infection. This is also worst one. So headache due to low CSF because it removes flotation of the brain. It will bang on your skull. Okay. Migraine headache, common. It's also common because you feel the vasospasm or pulsation on the head. Alcoholic headache caused by irritating the meninges of the brain because alcohol is irritant. Okay, so that's what we call the alcoholic in the morning. I don't drink alcohol, that's why I don't know I forgot the term, but it irritates the meninges. And then headache caused by constipation because it absorbs toxic waste products. So imagine if you are 3 or 4 days constipated, you will also have headache because it's there. You need to eliminate that. Types of extracranial headache are muscle spasm. Like if you have tight muscles at the back, it will pull down your head. It's not balanced, and it will cause headache. So also when you are stressed or emotional tension suddenly, okay, then you fight with your friends or your loved ones, so that could cause muscle spasm as well. Irritation of the nasal and accessory structures like sinusitis, you have that, so it will also transmit or refer pain on your skull. Okay, and even eye disorders as well, or because of the excessive contraction of the small muscle of the eye, it will strain the eye and cause headache as well. So these are some of the example of the headache. Nursing interventions: avoid precipitating factors. So if you're stressed, avoid stress. If you're stressed with your friends, then avoid them. If you are having an eye problem, then check the eye doctor to fix, so you could give what I call to that eyeglasses. Okay, so these are the most important. Avoid precipitating factors. Okay, if you are constipated, then you have to take fiber diet, increase water intake to loosen up that constipation. Modify lifestyle. Okay, remember, modifying lifestyle, diet, exercise, yoga, so those would help. And relieve pain by pharmacologic measures such as opiate derivatives. Usually they take Tylenol for headaches, so this could ease the pain easily. Okay, before, like, if you feel headache, you could take Tylenol, then you could sleep and relax. Okay, so those are for headache. I hope you learned from that. It's very short, but you could analyze on how you would have headache. If you have questions, comment down below, and thank you so much, and God bless.